In order to understand postpartum depression, it's important to understand what is normal after childbirth. Between 50 and 80% of new mothers will have symptoms of depression following childbirth. This is often called the baby blues or the postpartum blues. Rapid changes in hormones, in addition to the stress of bringing a new baby into the home, can lead to strong changes in emotions following childbirth. Women can experience symptoms such as irritability, mood shifts, and anxiety. She may feel overwhelmed by the responsibilities of having to care for a new infant. This is not abnormal. The symptoms of baby blues tend to peak around 5 days, and they're resolved by about 2 weeks. In postpartum depression, the symptoms persist beyond the 2-week mark, and they are often more severe. In postpartum depression, the predominant symptom is anxiety. Women may have anxiety about the health of their baby. They may have difficulty sleeping due to their anxiety. Women may feel as though they're a burden on other people. They may withdraw from their friends and their family rather than reach out for help. They may have scary thoughts, like thoughts about suicide or harm befalling their baby. If symptoms are persisting, if a woman herself is concerned that she may have postpartum depression, it is really important that she reach out for help. Women can reach out to their OBGYN, to their baby's pediatrician, to a lactation consultant. These people can help connect a woman to experts who can get them proper evaluation and treatment. Postpartum psychosis is a rare condition, and it is a medical emergency. Postpartum psychosis occurs in about 1 or 2 women per 1,000 women who give birth. It is most common in women with a history of bipolar disorder, but it can occur in a woman who has no history of psychiatric illness. In postpartum psychosis, a woman loses touch with reality. She may have hallucinations, she may hear things or see things that aren't there, she may have delusions, believing things that are not true. She may appear confused or disoriented to those around her. She may have obsessive thoughts about her baby that are not based in reality. Postpartum psychosis requires immediate medical attention. Often women with psychosis do not have insight into their illness, and therefore family may need to reach out for help. Postpartum obsessive compulsive disorder, or OCD, often involves a rapid onset of symptoms within a week or 2 after birth. Mothers may have intrusive thoughts or images of harm befalling the baby. They may have images of themselves hurting the baby, of dropping the baby, or of the baby dying in his or her sleep. While some intrusive thoughts might be common, up to 80% of women report these after childbirth. Women with OCD cannot push these out of their head. Some women with postpartum OCD will engage in compulsions to try to push these thoughts out of their head. These compulsions may include excessive praying about the baby, spending excessive time on the internet trying to reassure herself about the symptoms, or checking on the baby excessively overnight to make sure he or she is breathing. It is important to note that women with postpartum OCD are not at increased risk of harming their babies. All of these conditions that we've talked about are treatable. Some of the treatment may involve medication, but many medications are compatible with breastfeeding, and women should not avoid seeking help simply due to fear of the treatment itself.